Can inhaled corticosteroids be absorbed systemically in COPD? Have you ever wondered how medications work in our bodies, especially when it comes to managing chronic conditions like chronic obstructive pulmonary disease? Today, we are focusing on inhaled corticosteroids and their absorption in patients with this condition. Inhaled corticosteroids, often referred to as ICS, are commonly used in the treatment of chronic obstructive pulmonary disease. When these medications are inhaled, they primarily target the lungs, where they reduce inflammation and help improve breathing. However, a portion of the medication can also enter the bloodstream. This absorption happens through the lung tissue, and some of the inhaled dose may even be swallowed, leading to absorption through the gastrointestinal tract. But don't worry too much about this route. The liver usually reduces the amount that gets into the bloodstream through a process called first-pass metabolism. Interestingly, patients with chronic obstructive pulmonary disease tend to have lower systemic absorption of inhaled corticosteroids compared to those with normal lung function. This is largely due to the changes in lung structure and airflow obstruction that affect how the medication is deposited and absorbed. Research shows that the peak blood concentration and overall exposure to inhaled corticosteroids are reduced in these patients. Despite this lower absorption, it is important to note that inhaled corticosteroids can still have some systemic effects. These effects may include adrenal suppression, decreased bone density, and an increased risk of fractures, especially when higher doses or long-term use is involved. Most of these side effects arise from the portion of the medication that is absorbed through the lungs rather than the gastrointestinal tract. In terms of treatment, inhaled corticosteroids are particularly beneficial for patients with an eosinophilic inflammatory profile or those who also have asthma features. This is because the inflammation in chronic obstructive pulmonary disease is primarily neutrophilic, which does not respond as well to corticosteroids. Therefore, inhaled corticosteroids are not recommended for every patient with chronic obstructive pulmonary disease. When managing chronic obstructive pulmonary disease, healthcare providers carefully weigh the benefits of inhaled corticosteroids against the potential for systemic absorption and side effects. They often prescribe the lowest effective dose while considering individual factors like a patient's history of exacerbations and blood eosinophil counts. In summary, inhaled corticosteroids can indeed be absorbed systemically in patients with chronic obstructive pulmonary disease, mainly through the lungs. However, this absorption is generally lower than in healthy individuals. While there are possible systemic effects, careful management can help minimize risks and maximize benefits for patients.